Hello, everybody. Welcome to the LEAP Chat channel, brought to you by the Leap for Lupus Awareness Campaign. I'm your host, Chandra Hightower. You tuned into the first segment of Ask SLE Maven. This segment is for those of you who have questions about lupus or about your own situation that you might want me to address on my show. Our first question comes from Mrs. Smith Jr., and it is about how lupus affects the lungs and blood sugar. So I'm going to read you her question, and then I'm going to give you the answer. Okay, Mrs. Smith Jr. wants to know what type of respiratory illness does lupus cause, and she says she was diagnosed with COPD last year, and she has an abnormal heartbeat. She also wants to know, does it cause people to have low blood sugar or hypoglycemia? In lupus, someone who has lupus, you are particularly predisposed to heart disease and conditions of the lung. COPD is chronic obstructive pulmonary disorder or disease, and it is a generic term applied to any condition of the lungs that cause them to not function properly, such as asthma, um, pleuritis, bronchitis, things of that nature. And in lupus, because inflammation is one of the key symptoms, in lupus, what happens is particularly pleuritis, which is one of the criteria that is used to determine whether or not someone has lupus. The lining of the lung becomes inflamed, but the lung tissue itself can become inflamed. And when it does that, it causes problems with breathing. It causes pain. It if it goes too far, it causes destruction of the lung tissue itself. When you think about something becoming inflamed, or inflamed means heat. Okay, when you think about something that's burning, it destroys it. It becomes charred. It becomes, you know, and that's what happens in the body of a person with lupus when inflammation gets out of control. The tissue becomes destroyed. Okay, because the body is attacking it. And so, since the heart is right next to the lungs, it sits right there, you typically have heart problems as well. And it's what's called cardiopulmonary uh, disorder in a person with a lupus. And so, you can have an abnormal heartbeat, particularly it may be too fast. Um, the heart itself can become inflamed, the muscles of the heart, the lining of the heart, the arteries and the veins can become inflamed because the body is attacking itself and thinking that its own cells and tissues are trying to harm it. And so it's basically it's rejecting itself, it's rejecting its own organs and that nature. And so that's what happens in lupus with COPD or any kind of pulmonary, lung, or cardiac heart involvement. There are several disorders that you can develop because of that. I'm going to post links on the side so that you can go there and look further into detail. But there are uh, lupus can cause that, and particularly the medications that are used to treat lupus, specifically prednisone, can also contribute to um, dysfunction in the organs. The prednisone in particular causes plaque buildup in the arteries, and so you're predisposed to heart disease very, very early because of how the steroids metabolize in the body. And so I have a cardiologist. I have to go. I had an abnormal heartbeat at one time. I had high blood pressure at one time, and these are the things that are a byproduct of the use of steroids along with the activity of the disease, and it just kind of creates that dynamic of heart and lung involvement. As far as blood sugar goes, lupus in and of itself does not cause low blood sugar, but again, these steroids can contribute to that. You're predisposed to diabetes. Steroids basically they make you want to eat. When you're on particularly a high dose, you crave sweets, which increases your blood sugar. Um, as far as low blood sugar goes, lupus can do whatever it wants. I'm not sure in particular how it lowers the blood sugar, but because of how it affects the body in and of itself, it's bound to affect how the organ systems function. And so there could be some disruption in that. But in particular, I know that steroids can affect blood sugar levels. And so that's another side effect or byproduct of the use of steroids and how they metabolize in the body. And so I'll post links again to the side. I hope this information is helpful to you. I'm not a doctor, and so I'm just giving you information based on what I have read, and I really just want to address your question. If you really, if you want me to go into further detail, I'd be happy to do that. I only have 10 minutes to talk per show, and so I just want to give you just the meat of it. And basically, with lung and heart involvement, it is because of the inflammation that's caused by the lupus and the disease activity itself. And that's why you need steroids to control that. And then as a result, you have dysfunction in your blood sugar and things like that, and you're predisposed to heart disease and diabetes because you need the steroids in order to control the inflammation. So, and they're not the sole cause, but they contribute greatly to uh, to that. Steroids affect your hormones and everything. And so I'll go into further detail later on in the show as well as to how steroids affect the body and the mind. And so I hope that you found this information helpful. If, like I said, if you have any further questions, just email me. I have my links posted in other places now. So just, I hope you're doing well. I know that you sent me a message where you had gone to the doctor and you had some swollen lymph nodes and things of that nature. And so I hope you're doing well. I hope that you found this information helpful. And until next time, leap for lupus. Thanks for tuning in.